This is a C. Jason podcast, and I am Samuel Chan from the Department of Nephrology at the Princess Alexandra Hospital in Brisbane, Australia. Kidney transplant patients are susceptible to infections, but little is known about the burden of infection-related mortality in this population. To address this issue, we looked at all kidney transplant recipients who underwent a first graft between 1997 to 2015. Over 12,000 recipients were included from our ANS data registry. The mean age of our patients was 46 years, 60% were males, 15% diabetics, and 6% were Indigenous. 22% of this population died during the study period, of whom 19% died of infection. We found 4 significant observations. 1. The incidence of infectious deaths over the last 19 years has decreased from 53 per 10,000 person years between 1997 to 2000 to 44 per 10,000 person years between 2011 to 2015. 2. Of those who died from infection, 75% still had a functioning graft. 3. Kidney transplant recipients were approximately 8 times higher risk of infectious-related death, with female sex being 12 times higher compared with an age-matched general population. And 4, older recipient age, female sex, Indigenous ethnicity, use of T-cell depleting therapy, and having a deceased kidney donor transplant were predictors of infection-related death. Potential explanations for the falling rates of infectious deaths post-transplantation include changes in immunosuppressive therapies, for example, introduction of tacrolimus-based immunosuppression from 2005 onwards. Improvements in infection control measures, for example, patient charting and increased attention to hand hygiene. More widespread use of antimicrobial prophylaxis, such as CMV prophylaxis, and recommendations to reduce overall immunosuppression in elderly transplant recipients. The increase in mortality associated with female sex is interesting. This may be because of sex-specific differences in immune responses, sex-specific pharmacokinetic and pharmacodynamic immunosuppressive responses, greater degrees of HLA sensitizations in females leading to different immunosuppressive approaches, selection bias, and sex-specific differences in the propensity for infection. So although infection-related mortality rates appear to be improving, a lot of work is still required to reduce this burden in our transplant community. We hope you enjoy reading our work. We believe this information will better inform shared decision-making by both patients and clinicians.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.